Another aspect of ophthalmic ultrasound imaging, which is critical to ophthalmic oncology, is dynamic ultrasound imaging. Here we see various things that can only be seen with movement, like convection, after movements, intrinsic vascularity within the tumor, gravity-dependent movements, reflex movements, and it allows us to record the entire exam so that another physician can view it. Here's an example of asteroid hyalosis. You can see the material is moving with eye movements. That's called after movement. One of the most important findings in dynamic ultrasonography in ophthalmic oncology is intrinsic tumor vascularity. This is a choroidal melanoma, and you can see the twinkling inside. That's blood flow. Things like hemorrhage and other tumors won't necessarily have blood flow. It's not a diagnosis, but when you see that, you know that this tumor has blood vessels. Now look at this one. You see the intrinsic vascularity, and this eye is just filled with hemorrhage. So without that vascularity, it's not so obvious that this mushroom-shaped melanoma is there. This is a choroidal hemorrhage. Here we have after movements. Look inside. It's not twinkling. It's sludging like blood underneath the retina. Here's another example of the same, but this blood is more liquefied, so you see even more movements beneath the retina. That's definitely not a solid tumor, and it's not a melanoma. Here we have an example of endophthalmitis, an infection that fills the entire eye and causes a shimmering after movement. So we also use B-scan ultrasound imaging to look at the orbit. And here we have an orbital tumor, and it's pulsatile. You can see it pulsating on dynamic exam. Certain tumors pulsate, other tumors don't. It's one way we can differentiate between pulsatile or highly vascularized tumors and those with low flow. Here's an orbital varix right there. You can see if you push on the eye with the B probe, you can reduce an orbital varix. It's another way to help make the diagnosis. And here's something more common with like a retinal hole, which you can clearly image with B-scan ultrasonography, helping to separate it from an exudative detachment from a regmatogenous detachment. And here's just an old retinal detachment that's a little jiggly. As you know, as the detachments get older, they get less mobile. So you can have an idea how long the retinal detachment's actually been there. Here's an old one. You see it doesn't move at all. Goes right back to the optic nerve and stiff as a board. Look at this one. Here we have a detachment that's slowly changing with eye movement. We call that shifting fluid. We see that with exudative tumors that are making fluid beneath the retina, and that turbid fluid shifts along with the movement of the eye. Here's an excellent example of a choroidal melanoma with a shifting fluid retinal detachment. You see that the detachment will move when the eye moves. That's because there's no retinal hole for the fluid to get out. It's all underneath there like a blister. So in conclusion, dynamic ultrasound imaging allows us new views and better ways to understand the pathophysiology of the tumors that we see. On occasion, it helps us differentiate benign from malignant tumors, vascular from low-flow tumors. It also allows us to record the entire exam and review it in the future and use it for teaching. For further reading, we have several papers on three-dimensional ultrasound imaging. I particularly like this one where we went back from after enucleation, we went back and looked at the ultrasound, and we found the exact same, we were able to reconstruct and find the exact same cut as what the pathologist had of extrascleral extension for choroidal melanoma. This is one of a series of lectures that I'll be giving online, and I hope they're helpful for you in your practice. Feel free to contact me if I can answer any questions. I want to take a moment to thank you for your attention, and to thank the Eye Cancer Foundation, who supported much of the research presented in this lecture, and for their committed support for international multi-center cooperation in ophthalmic oncology. Thank you and have a nice day.